This is the recorded lecture for Chapter 6 for Information Technology for Health Professionals. And we're going to look at information technology specifically in the area, the arena, if you will, of radiology. And information technology has changed radiology significantly from the old mechanism of films and development solutions and such into a digital format. And we're going from that to the PACS systems that are really making radiology a much more efficient process. So we have computer-based imaging techniques now that we use, and those include, hold on a minute here. Those include computer-based imaging techniques use computers to generate pictures of internal organs of the body. And so they're computer-directed. Now, a digital image is an image in a form computers can process and store in bits, so to speak. It stores it as a graphic. And even older technologies, X-ray and ultrasound, are now computer-based. We save them digitally, not on film, which is very important. Now, when we look at X-rays, traditional X-rays use electromagnetic waves to produce an image on film, radiation, if you will. And digital X-rays are immediately available on the screen from that technique and expose patients to less radiation. So we can get a better look at the information. We have to submit patients to less radiation to get the picture, and we get a better picture. So X-rays are used to image broken bones in mammographies. They can tell us, image hearts. They can image lungs and all that kind of thing. They're very, very important. This is a look at a chest X-ray, if you will, and that it uses a high-energy electromagnetic wave, and it creates this picture. And anything that has greater density shows up as white. Anything that has less density shows up as black. And so these are the lungs, if you will. They're full of air, and so air is image density, so you see black. This is the cardiac silhouette right here. Here's the diaphragm, and you can see that it has a greater density. And so by looking at that, you can determine, for instance, somebody has pneumonia, somebody has a tumor in their lungs, those kind of things. Now, ultrasound uses sound waves and echoes that are produced to generate an image, and they can work with a moving image, and they use no radiation. So it's a totally different mechanism of collecting information. We use ultrasound to study developing fetuses and to diagnose prostate disease and gallstones, and it's useful in diagnosing cancer in pregnant women also because we can use that in lieu of radiation. This is a ultrasound of a baby. You can see the baby's head right here. The baby's head right here. There's the body of the baby, and so you can see this is a very old ultrasound. By the way, nowadays they're in 3D and in color, so this is a pretty old ultrasound. Ultrasound gives you a three-dimensional ultrasonic endoscope, which is currently being developed for use in minimally invasive surgeries. So we can put this endoscope in, we can insert it, and then we get an ultrasound of the area around it. So a tiny ultrasound device about the size of a silver dollar is being used to monitor the fetal heart rate. So it's a pretty interesting technology that's really technologically is getting much more efficient and complex. Now, CTs are computerized tomography. You'll hear the term CAT scan. Please don't ever say that to me. CAT scan is not really, I know people say it all the time, but it's really a CT scan. We don't use any animals to create this CAT's joke. Computerized tomography uses X-rays at many angles from which the computer creates an image. So it's really multiple X-rays showing it from a 3D side. So soft tissue can be imaged because we use much smaller amounts of radiation from different locations. It's more accurate and detailed images decrease the need for exploratory surgery because we can identify whether there's a problem or not, and we use those a lot more now. For instance, when I was a young PA, when we thought somebody had an appendicitis, we'd do the surgery. And nowadays, we didn't do anything else. We did an X-ray, and that was all. Then we do a surgery. Nowadays, we do a CT scan to determine if truly we have an inflamed appendix, and so we can save some people having an unneeded surgery. Now, the truth of the matter is that the number of people that had unneeded surgeries for appendicitis was probably less than 3% at the worst and less than 1% at best, depending on what data you look at. So the number wasn't really, really high, but it did save a few patients from having unneeded appendectomies. According to the government study, 2010, annual chest CTs should save lives among many heavy smokers because it shows early tumor signs, so we can get the tumors long before they start to spread throughout the body. This is a CT scan of the human chest and abdomen, and you can see and what happens is a CT takes different pictures and it layers in, so it goes in 1 centimeter, 1 more centimeter, 1 more centimeter. So and we're going deeper into the human body. Here's a more superficial look. This is a much deeper look, and we start to move in. You see the spine. There's the pelvis, if you will, and as we move backwards, we see only the very top of the pelvis because we're moving deeper into the body. This is a transverse cut through the body, if you will. This would be a coronal cut, or a frontal cut would be the term we use. Now we also use MRIs, which is magnetic resonant imaging, and it uses computers and a very strong magnet field and radio waves to produce these pictures. And what it does is it aligns all the cells so that they're positive on one end and negative on the other, and it takes that picture. So the MRI, this is an older MRI machine. We have new ones now, which are not totally in a closed circle. People that have trouble with weight, obesity, they can then get in and out of that. Or if they have claustrophobia, they can see they're not totally surrounded by this machine. Now, the good news is it does super imaging. The bad news is it's noisy as heck because you hear the banging of the mechanics of it, and so it can kind of drive you crazy. MRIs, it images soft tissues. We use it a lot for imaging the brain. It can find some brain abnormalities, for instance, a aneurysm early in the process. It can detect abnormal tissue. Women with high risk for breast cancer benefit from yearly MRIs along with mammograms, so we can find cancer much earlier than we used to before. Now, functional MRI, fMRI, if you will, can image function by measuring small metabolic changes. It can locate areas of brain affected by stroke or brain tumors, and this is used to study conditioned responses. So if we do something with a patient, we can see if any differences in the brain occurs. And it's used to study schizophrenia also. We use it to predict dementia in patients as young as 18 who have a genetic mutation or a genetic predisposition to developing early dementia. Diffusion tensor imaging, MRI, DTI, shows the white matter of the brain and the connections between parts of the brain so that these are not damaged during neurosurgery. So it literally helps to prevent peripheral damage or collateral damage during surgery. Another methodology for imaging is called a positronic emission tomography, or a PET scan. We seem to name all our scans by animals, I guess. But a PET scan, it uses radioisotopes technology to create an image of the brain or body in motion. It's used to study mental disorders, speech disorders, Alzheimer's, moral reasoning if we look in the frontal lobe, bipolar disorder, and cancer. So it gives us not only an image, but it also gives us the function or the functionality of the image. This will look at a PET scan of the human brain. You can see this one's much different than this one, and this is diagnostic of certain diseases. Now, PET scans are used for accurate diagnosis, for instance, of breast cancer. They measure an esophageal cancer patient's response to chemotherapy, radiation therapy before the surgery, and PET scans can even detect metastases, that's the spread of diseases that other imaging techniques can't really see. So you can show the function of the brain by measuring cerebral blood flow. So it's a much more accurate technical scan than others. Now, a SPECT scan is a single photon emission computerized tomography, a SPECT scan, and they're used in nuclear medicine. And they depend on gamma radiation, which shows movement, and they can show movement. They can be used to study blood flow, stress fractures, infection, tumors, and are used in the majority of heart imaging and some bone scans because it shows it literally is a flow of what's going on. It's not a picture; it's more of a video. Bone density scans, or DEXA scans, are called. A bone density scan, or dual X-ray absorption scans, are used to diagnose osteoporosis because they look at bone density. And it's used as a special kind of low radiation X-ray that shows changes in the ray's intensity after passing through the bone. So small changes in bone density will show up as a change in the X-ray. So a DEXA scan is now the gold standard in how to differentiate whether a person has osteoporosis or the beginning of osteoporosis. Other imaging technology include the LUMA, LUMA cervical imaging system, and it's used to detect cervical cancer. INOVA, a digital flat panel biplane imaging system, can be used for many interventional image-guided procedures. We use this in the operating room. So we may use it to direct us to where a disease might be. It's sort of like a video of you can take a probe and put it to the site, and address it. For instance, if we were going to address a cancer somewhere in the brain, we could take a probe and put it into the brain and only provide radiation at the very point of that probe, which is kind of interesting, so we don't have, again, the collateral damage. PACS, my favorite thing to talk about, is Picture Archiving Communication System. It is the digitalization of radiation, and it transmits, stores, and retrieves and displays digital images and communications information over a network. PACS is the server, so it stores all this up. And what we do is we then put monitors in throughout the hospital. So if a digital image is made and the radiologist sees something on the digital image, he or she can then make that available on the monitor to the provider who's providing that care, and they can discuss what's going on with that. It's literally a instant consult, and it provides a much clearer image. There are a lot of issues, imaging that's fraught with all sorts of problems, but this improves those problems, and it makes it a much clearer image and much more optimal for the patient. DICOM is digital imaging and communication in medicine. It comprises the standard communication protocols for imaging devices, which directs how we store and transmit them, so that one system isn't different than another. Now, interventional radiology is radiology we use, like stereotactic radiosurgery, which is a gamma knife surgery. It's a non-invasive technique used to treat brain tumors, and you think of it, and it focuses different beams on the radiation on the tumor. So here's kind of how it works. Think of putting a bowl over the top of their head, and that bowl has multiple radiation guns, if you will, that shoot a very small amount of radiation from different directions. So it's like multiple beams going to one site in the brain. And each of those beams is a very low level of radiation, which doesn't hurt any tissue whatsoever. But when all those beams are concentrated in one site in the brain, they are able to create enough radiation to kill the tumor that's located there. That's what stereotactic radiosurgery is. The newer cyber knife can be used in non-invasive techniques to treat other parts of the body. So this technique can be used in other parts of the body. We're seeing that now. Focused ultrasound is used to raise tumors to the boiling point, if you will, and so we can destroy them. So we're going to destroy those tumors using focused ultrasound. Now, interventional radiology equipment allows neurosurgical repair of some thoracic abnormalities, if you will, or allows non-surgical repair of some thoracic abnormalities. So we can fix those without surgery using this gamma knife, so to speak. The gamma knife is also being used to treat neuralgia, which is pain of the nerves, intractable pain, Parkinson's disease, and epilepsy. So we start to use this gamma knife instead of going to the surgery proper. So basically they just focus that gamma radiation in one site to kill whatever's causing the problem. Now, radiofrequency ablation, RFA, can be used on cancerous tumors on the liver or lungs, so that, again, we don't need to go in and do the surgery, we just do the radiation. Now, interventional radiology is used in the treatment of blocked carotid arteries in patients who do not exhibit stroke symptoms, and to treat and reverse male infertility with improved embolization procedures. So we can basically laser out, for lack of a better word, laser out the areas that we need to get rid of, like a blocked artery or maybe a vas deferens in a male where the sperm flow through, so they can eliminate the blockage, if you will. Lasers are being used to treat children with painful vascular malformations because they can make them go away pretty easily without surgery. Interventional radiology is being tested as treatment for uterine fibroids with 92% success rate. Uterine fibroids are tumors that occur on the uterus and can get as large as grapefruits. I've seen them as large as a grapefruit in surgery. And they can eliminate them when they're smaller through this interventional radiology technique, so there's no surgery necessary. They basically just destroy them with this radiation. They just basically deteriorate the body, cleans them up. So this is a person undergoing radiosurgery, if you will. They're using radiation to treat the problem, if you will. Now, the dangers of medical radiation in the United States, the average lifetime dose of diagnostic radiation has increased 7-fold since 1980 because we use it more and more. And more than half of all cancer patients receive radiation therapy because it's functionally and therapeutically indicated. With the increased use of radiation come increases in severe injury and death. So there is that other possibility of death from this radiation. Between 2000 and 2010, there were 1,000 reports filed of injuries and deaths involving radiotherapy equipment. So it is out there. It is a consideration. So in conclusion, the great improvements in imaging techniques have made surgery more precise and reduced the need for actual exploratory surgery. And the growth of interventional radiology has made it possible to surgery without using a surgical knife, a scalpel, if you will, and improve that process. This concludes the chapter. Thank you very much.